Let us take you to Saudi Arabia, where an emerging disease has been identified. The Middle East Respiratory Syndrome, or MERS, is caused by a coronavirus transmitted from dromedary camels to humans. We have identified 3 target interfaces for disease transmission. Firstly, humans can contract this viral disease through close contact with camels, especially at camel markets, which are a popular tourist attraction. The virus may also be contracted when consuming raw camel milk, undercooked camel meat, or camel urine. Farm workers and veterinary professionals are at a higher risk as they are more likely to interact with young camels still shedding the virus.
The second interface is that of human to human. The virus does not seem to pass easily between humans except when they come into close contact during unprotected healthcare, like not wearing gloves when treating patients. Immunosuppressed people, the elderly, and people with chronic disease are affected more severely. The third interface is the natural reservoir maintained by Chinese horseshoe bats, which transmit the disease to camels. Recombination events occur in the bats that lead to variant strains that are already pathogenic to humans.
The negative health effects at the molecular level involve virus interaction with specific receptors on non-ciliated bronchial epithelial and alveolar cells. The virus is known to inhibit important cellular pathways, cause severe inflammation in the lungs, and inhibit human myeloid progenitor cell production. A driver at this level is the ability of the virus to adapt to firstly evade the immune system and secondly to become more virulent, resulting in a higher infection rate and greater morbidity. At a species level, coronavirus causes fever, cough and pneumonia as well as diarrhea and sometimes organ failure in humans, resulting in 30 to 35% fatality rate, resulting in production losses. Camels only suffer from asymptomatic or mild respiratory disease and are considered a reservoir for the disease.
Hunger and cultural practices are the main drivers at the species level, since people are dependent on the camel milk and meat as a source of protein. An economic driver of the disease comes from the fact that camels are used for transport and they are a major source of income for the lower class people of Saudi Arabia. The upper class partakes in camel racing, which facilitates the spread of this disease. On a systems level, the close contact between camels and humans will cause more and more transmission of the disease within communities and therefore more significant healthcare associated outbreaks. An outbreak in nosocomial infections in Saudi Arabian and North Korean hospitals has resulted in closure of some hospitals because of diffuse contamination of the hospital. The virus is present in raw milk, meat, and camel urine, which represents a public health risk, and lack of education and hygiene will perpetuate the health risk.
International travel drives the spread of the disease as people are forced into confined spaces like aircrafts, increasing the likelihood that the infection may spread among humans and across international borders, as happened in North Korea. Nosocomial infections are driven by the congregation of infected people at healthcare centers, and those centers failing to implement adequate biosafety measures, like wearing gloves and isolating infected individuals. Preventative actions for mitigating the negative health-related interactions or drivers at the molecular level would be to implement a vaccination protocol for both animals and humans, which is currently unavailable but being developed.
The stakeholders playing a role in this are research institutions undertaking studies on prevalence of infection in camel populations, livestock and wildlife serology and longitudinal studies in select camel hosts. The UK Ministry of Agriculture is a stakeholder as they are undertaking vaccine field trials in female camels and studying the effects in their offspring. The World Health Organization has developed general precautions for anybody visiting farms, markets, and barns or places where camels would be present. They recommend regular hand washing before and after touching animals, limit contact with sick animals, and avoid consuming undercooked camel meat or raw camel milk.
The IGAD Centre of Pastoral Areas and Livestock Development collaborate with the Emergency Centre for Transboundary Animal Disease to create awareness about MERS through public education and should also collaborate with local government institutions. Once a vaccine is developed, the local government should host nationwide vaccination campaigns. Infection can be prevented by wearing personal protective equipment like face masks and using caution when performing aerosol generating procedures such as bronchoscopy, sputum induction, extubation and CPR. Veterinarians should also take care to use protective clothing when working with camels to protect themselves against infection and to prevent the spread of the disease to other camels.
The World Health Organization developed guidance and training schemes to educate medical and veterinary professionals on the disease. They provide guidance for flight crews, emergency medical service units at airports, and U.S. Customs and Border Protection officers about reporting ill travelers to the CDC. The World Health Organization's Regional Office for the Eastern Mediterranean are initiating sentinel site surveillance systems to detect respiratory disease in humans.